Good evening, participants. Thank you for joining Shield Connect today. And today we have Dr. Fazalunisa ma'am, and she's going to take topic oocyte quality and female infertility. So let me give a quick introduction of ma'am. Ma'am is a obstetrician and gynecologist and infertility specialist, and has done advanced ART in Dubai and diploma in ART from Germany. And ma'am is the managing director of Hira Fertility Center in Hyderabad. And recently, ma'am has won the nationwide award for most promising infertility specialist in 2020. So I welcome you, ma'am, on our platform, and we can start with the session. So
Yeah,
I glad to welcome you on our platform, ma'am.
thank you so much. Thank you, Nishant. So today's topic is a very interesting and clinically, if we have to see what is the thing which is important for success rate, the most important thing, as we know, is the oocyte quality, because 80% of the embryo which is formed is from the oocyte. The nourishment, the nutrients, and everything from of the embryo is imbibed from the oocyte, right? So uh, in the same way, uh, yeah, in the same way, today we are going to discuss what is effect of oocyte quality on the fertility. Yeah. So women believe that the egg count, how many eggs that she have, is primary indicator of their fertility. Both the egg count and the egg quality is an indicator. Okay. And the lack of proper test to find out how actually this works, how good or bad your egg is. We have two or three tests, but of course they are not like very accurate. Yeah. So the next slide, please. So now what is the oocyte quality? So, so oocyte quality is something wherein you have to see how much ability does it have to fertilize, how much ability does it have to undergo a meiotic division, how much ability it has for the development, and how much ability, the final result is pregnancy. So whether this oocyte is going to give us the pregnancy or not is the final question. Yeah, so that is what determines the oocyte quality. Next slide, please. Can you guys see me actually?
Yes, ma'am.
Can you guys see me? Because I can't see myself.
Yes, ma'am. We can see you.
Okay, fine. So, like, as we all know that as the age increases, the quality, quantity, the birth capacity, the fertility capacity, the division capacity, all the qualities of egg come down. Okay, so from starting from the birth to puberty till menopause, there is a rapid decline in the fertility after the age of 35 years, and 35 is that crucial number for a girl's fertility, for a woman's fertility. Okay, so that is how 35 is the indicator, that indicator of pre and post fertility for a woman. Next. So yeah, how does the quality, I mean, what is the number of chromosomes that we need? So obviously in a sperm or a ovum, we need to have only 20, a pair of 23 chromosomes, because anything out of that is abnormal, or anything other than that will give rise to an abnormal baby or a genetically abnormal baby. Okay, so 23 is the number which is there for a normal egg. Next. So yeah, that is how all the autosomes are inclined. And here, as we can see an abnormal, one egg becomes abnormal and it can't become normal again. Once the egg quality becomes abnormal, like say suppose all the other autosomes are normal in this, but you have XXY in this. So one extra X chromosome is also abnormal, and we can't rejuvenate it, or we can't make it back to normal. Once it is abnormal, all the other cells are gonna have it. Next slide, please. Next, yeah. So this purely is a function of age, and women in 20s will have normal eggs. Even if you want it or not, in 20s you will have a beautiful eggs. Even in 40s, if you try for to live a healthy lifestyle, and if you try to do all that is possible on earth, there will be some abnormal cells, because as the age increases, the egg quality will definitely decrease. Next slide, please. So yeah, as I told you, that magical age is at 35. The egg starts decreasing. Say, suppose you have 8 eggs in each ovary, that will fall to 50% by the age of 35. And they start decreasing. And by 43 and 44, the abnormal cells are more and the normal cells are less. Next. Next slide, please. So what is the fertility and equality are directly connected, because women's ovaries are naturally programmed to allow to just there's only one egg which we need for the birth of the baby. So that good egg will grow, mature, and come out as a fertilized egg, and that will ovulate, and that will only give to rise to an embryo. But that one egg represents the one chance of pregnancy. So that one egg, which is, if it is ovulated, which is abnormal, that will not go for fertilization, that will not create an embryo, and that will not result in a pregnancy. So that is how our eggs become weak as we age. Right? Next slide, please. So oocyte selection is based on morphological parameters. Like, say, suppose after a pickup, after an IVF, what are the parameters that we need to look for, in which we can predict the oocyte quality? It has been speculated that some morphological irregularities that are easily associated with compromised developmental ability. So these are few markers. So if you see these are the things. If you see these things, that means the oocyte quality is going to be bad. Okay, so what are those qualities? Next, we'll discuss. Next slide. So what are the factors influencing oocyte quality? So the fresh matured oocyte with intact. So most important is the polar body. As we know, the polar body is there with the along with the oocyte, because it is nothing but the M2 oocyte should have a polar body in it, within the zona pellucida, because that means when there is a polar body, that means the oocyte has matured. Okay, and along with those glycoprotein, it also contains something called as meiotic spindles, and meiotic spindle needs to be aligned in the chromosome and the microtubular lining, along with the plasma cell membrane located in the spindle poles. So as we say, as you can remember, this is the cell, and at the top and the bottom will be spindles. So these are called as the meiotic spindles. Okay, these are the ones which help in the growth of the egg. And at the pre-vitelline membrane outside the egg, there is a small polar body which indicates that it is a matured oocyte. And the zona pellucida is, the zona pellucida has a lot of cumulus. We have pictures in the next slide. Next slide. So the aging or over maturation of oocyte is associated with numerous. So can you see this picture wherein you have the yellow part, which is actual oocyte, and the blue membrane which is there, that is called as zona pellucida. And outside the zona pellucida, the purple color cells which you can see, those are the cumulus oophrys, and these are the cells which help in nurturing the oocyte and helps in development of the oocytes, so that it is guarded, it is protected when it is coming out for fertilization also. This cumulus oophorous cells helps in nourishment of the ovum oocyte. Okay, so can you see that in pre-vitelline membrane there's a small first polar body. So the first polar body is very important, and that first polar body indicates a maturity of the oocyte, that is M2 oocyte. So that is how, and the presence of PB1 and the attachment of cumulus cells is a major indicator to determine the quality of oocyte. As I told you, whenever there is cumulus oophorus, which is around protecting the cell, all this will define a good quality oocyte. Next slide, please. So how important is this first polar body? This first polar body is occurring as soon as the cell is coming out. Like once it has ovulated, the first polar body comes. And when does the second polar body comes? As soon as the fertilization happens, right? So the first polar body comes when there is ovulation. Second polar body comes when there is fertilization. So the recent studies have investigators that there is a morphological correlation between the polar body 1 and the oocyte competence. So although the PB1 does not participate in the development, but it has a morphologically, it is frequently we allow to check the oocyte quality. So if the PB1 is like too big or too small, or it is displaced, or is there any abnormality in the structure? So this is how we will decide the quality of oocyte. Oocyte with intact PB1 will have high fertilization rates. As I told you, it has high fertilization rates, high quality oocytes, and if it is large, irregular, roughly shaped, so then that will determine the low quality of oocyte. Next slide, please. Yeah, so PB1 shows the displacement from M2 spindle at nuclear form maturation, and the distance between the PB1 and M2 spindle increases over time during oocyte aging. Moreover, the pre-vitelline space increases over time and facilitate. Yeah, so all these are the indicators of PB1. So if it is too far or too close, or if it is displaced from the center, so that is how we determine the quality of oocyte. So basically the polar body and the meiotic spindle, they come in one alignment, they come in the same angle basically. Next oocyte, next slide please. So now what is this meiotic spindle? This meiotic spindle is the spindle which helps in the growth and the development and cell division basically happens through this meiotic spindle. And it is very important because the distribution, the cytoskeletal structure, and the equal distribution of the embryo, like it's called 4 cell, 8 cell, and then 16 cell, right? So the equal distribution happens with this meiotic spindle. And in fresh oocytes, the spindles are in a very vertical orientation with respect to the ulema. So if you see uh, oocyte, they're exactly like in vertical, at exactly vertical spacing is there. They're not either tilted or they are not displaced. So if the oocyte spindle is very much correct, then the embryonic development is also perfect. Like you have equal cells of growth, like 4 cell, 8 cell, 16 cell, and so on. So the morphology changes during the aging of M2. The spindle becomes elongated because of the loss of retention in microtubules, and that becomes weak. So yeah, as the age oocytes, the spindle also becomes very brittle, and there is displacement of the spindle, because of which the quality of oocyte also decreases. Next slide, please. So the shape of the spindle is determined by the position of the spindle pole and it changes over time, as I told you. And the oocytes exhibiting a reduction in distance between the cell spindle and polar body have higher developmental potential than those exhibiting a increase in the distance. So the polar body, as I told you, and the spindle, they should be in a very uniform distance. If there is an increase or a gap between them, there is a decrease in the oocyte quality. When the distance between the plasma cell membrane is short and it is rhomboid or spindle body is formed, the distance increases, and that distance will form in large spindle. And this large spindle, the morphology of the meiotic spindle is an important oocyte. Yeah, so as I told you, the meiotic spindle has to be at a specific site and has to be below the polar body. And when we are seeing, the distance should not be too high. It should be close to the plasma membrane. Only then there is going to be an equal distribution. Next slide. Cumulus, as I told you, is the cells. This help in nourishing the oocyte, and they help in energy production. And so this is called as cumulus oophorous complex, and it protects from the oocyte from the reactive oxygen species. Basically, they are cushioning. They are like cushion cells for the oocyte. And recent studies suggest that the mitochondrial function of cumulus can be directly it has the ability to achieve successful IVF pregnancy. Next slide, please. And mitochondria, as we know, the mitochondria are the powerhouse of the of any cell for that matter. So the higher the ATP content in the oocytes, the more the ability of the embryo. This has a direct correlation with the embryo formation as well as the pregnancy rates. A lot of research has been done on mitochondria, and there was a concept where they took the same nucleus and they had tried to replace the mitochondria with the younger cells, and some of them have been successful, but it is of course under still under experimental stage, wherein the oocyte genes would be the same for the oocyte, but the mitochondria were taken from a younger mother. And the mitochondrial dysfunction has been implicated uh, in the decreased quality of oocytes, and clinical experimental data have suggested that decreased oocyte quality is the main factor in the age related. So as the oocyte
Ma'am, you are on mute.
sorry,
Sorry.
the mitochondria is going to decrease definitely once the age increases. So that is the reason why the mitochondria are very important as the powerhouse of the cell. As the higher ATP is there, the better the oocyte quality. Yeah. So this is one very important point, that mitochondria is a very, very important part for oocyte prediction. Next slide. So oocytes with higher concentration of ATP has better blastocyst rates. Lower ATP has, very partially they have like positive spindle and IVF formation. All these have been decreased in lower ATP, and ATP is extremely important for nuclear and cytoplasmic maturation, right? And due to critical role of this oocyte maturation, ATP content has been proposed as an indicator. It is an indicator of developmental potential usages. Next slide, please. So, so there are a lot of molecular markers which have been coming out to see what is the good quality of a oocyte, but these have all been still under research, because these are all like very expensive, like molecular markers and all of that is like really expensive. So they're still under the research stage, but still we will see, have a look what they are. Next slide. So basically, the microarray studies have showed that multiple studies have been performed to identify the markers that are associated with the competence of oocytes. So these are the markers which will help in checklisting the quality of the oocyte. Okay, so based on meta-analysis, what do we have? We have the 63 candidates have undergone the oocyte quality check, and some of the biological markers have been worked out. So they are the following. Next slide. Yeah. So microRNA. So microRNA is one indicator wherein which has you know much it helps in it is released from the theca cells and granulosa cells, cumulus cells, and all of this. So recent studies have shown that the presence of cell structured vesicles in the follicular fluid, the cell secreted vesicles contain small non-coding regulatory RNA. These are called as microRNA, and which can be shuttled between maturing gametes and surrounding somatic cells. So these are the cells, these are more like messenger RNAs, so they shuttle between the somatic cells as well as the germ cells. Next slide. The extracellular microRNAs of follicular fluid, the one which we get in follicular fluid, are associated with fertilization ability, early embryo quality. Little is known about the mechanism, of microRNA, but these cells are definitely are involved in oocyte maturation. So these are definitely involved in oocyte maturation. These microRNA are involved in gamete maturation, and they are potential therapeutic targets and diagnostic markers that are associated with fertility. These are definitely still under the research, but if you take out this microRNAs from follicular fluids, the more the microRNAs, the more the fertilization capacity and the quality of the oocytes is higher. Yeah, next slide. I hope people are understanding what I'm trying to say. Hello? Yeah. So visualization of oocyte quality by intracellular temperature. This was one very good study. The oocyte during M2 arrest in height is it's a very dynamic stage. And with spindle microtubules and keeping all the chromosome perfectly aligned, it's a very difficult task in the metaphase. No, it is called as metaphase plate, through which all the cells are held together. So furthermore, the mature oocyte at M2, substantial changes such as spindle formation and chromosome alignment and mitochondrial activity, all this happens at the stage of M2 metaphase. So a mitochondrial activity to acquire development competence occur as a potential. So all this will help in increasing the temperature of the cell. So once, next slide. So intracellular temperature in mature oocytes is higher in fresh oocytes immediately after the PB1 extrusion, and the temperature decreased with the time after polar body is released. So once the polar body is released, the temperature has come down. And once before the metaphase, the temperature was higher. So the difference in oocyte intracellular temperature can correlate with developmental competence. Fresh oocytes had higher temperature regions localized around the cell membrane and around the spindle. Next slide. So as you can see, this is before at the time of metaphase. Okay, the cell had more temperature because it had to hold all the chemicals and everything. And once the maturity M2 oocytes have started its alignment, the temperature has come down, so it has become blue. So you can see the quality of development and everything with the temperature, intracellular temperature. Next slide. Common features of oocytes, particularly their physical appearance and size and shape. Next slide. So yeah, so homogeneous cytoplasm is the most important factor. Next slide. So centrally located granulation, so which is not good for the oocyte quality. Next. So cytoplasm with smooth endoplasmic reticulum is a big no because that will not help in blastocyst formation. Next. Cytoplasm with several small vacuoles, like if it is less than 10 micrometer, then it is fine. If it is more than 14 micrometer vacuoles, then there is a problem with the oocytes. Next. So these are all studies which help in, after egg freezing also, the increasing option for women who are not ready. So the egg freezing is one major breakthrough technology which has happened, that the women want to postpone her pregnancy but still want to preserve the age, get her stimulated and preserve her eggs in 30s so that she doesn't have to face all the difficulties in her 40s. Next slide. So how to improve the egg quality? Live a healthy lifestyle, maintain a healthy weight. Next. Manage stress, because pregnancy is opposite to the stress. As the stress increases, pregnancy runs away from you. Next. So smoking, caffeine, and alcohol is a big no, because these will decrease the egg quality. Next. So keep taking supplements like antioxidants, but don't take them too much, because taking antioxidants for more than 6 months is not required or not recommended. Next. So eating good food is the mantra for any disease for that matter. Next. That's it. So whatever you do, finally, your egg quality will decrease after once the age is decreased. So that is one thing. And the second thing is, your genetically, you have to be blessed genetically, because for some people, even in 40s, they have the capacity to give rise to birth. For some people, even in 30s, they don't have the capacity to give rise to the babies. That depends upon the oocyte quality. So that genetic um, constitution matters. So yeah, finally, age is the most important criteria, and all those people who want to postpone the pregnancy, please get your eggs frozen, freezed. That's it.
Thank you, ma'am, for giving all this detailed information, like molecular information regarding the oocyte quality.
And it was
And
exhausting, right?
no, it was very interesting. It was something new that we have seen in this PPT. So let me see if we have any queries.
Okay.
So, ma'am, one question is
Mhm.
what is your thought on the PRP method for getting good quality of oocyte?
Yeah. So I am the PRP expert of my area or of my
Hmm.
division, I would say, because
Yes,
we
ma'am.
have done more than, I think, more than 50 PRPs. But out
Hmm.
of which I should say, out of 50, 23 to 22 were successful. So yeah, definitely there is an increase in oocyte quality, but only for 50% of the people. But even here, the criteria is below 40, you have better
Hmm.
success rate. More than 40, you have lesser success rate. So
Okay, ma'am.
time is the magical number. Age and time is the magical number. That's it.
So, ma'am, then what is your thought on egg donation?
Egg donation. Egg donation
Yeah.
definitely, because after a while, how much ever you are trying, you would not, the embryo quality won't be good. Even if the embryo is going and sticking, you would have, a lot of miscarriages.
Mm-hmm.
So at one point of time, yeah, we have to accept and we have to go for egg donation.
Okay, ma'am. And one more question is there any studies regarding COVID affecting the quality of oocytes?
Definitely, there is a. I mean, we need to come out with more of these
Mhm.
because before and after COVID, uh, I am not sure about the oocytes, but the quality of sperms have drastically come down. Like there are people who have gone for less than 5 million also with this virus, and after
Yes.
3 4 months they have recovered, but still the
Mhm.
morphology wasn't the same. It wasn't great, and
Mhm.
so it must be doing some kind of harm, definitely at genetic level. The pre and
Mhm.
post-COVID results are also variable. Like people who have got COVID and have not got COVID, their results are definitely different. So we need more studies on that.
Okay, ma'am. Thank you, ma'am, for giving all the answers to these questions.
Yeah,
And we
thank
would
you so
like to
much.
have you more on our platform with some new topics. Thank you
Definitely.
so much, ma'am. And I also thank you, delegates, for joining to this webinar. So, thank you so much, everyone.
Thank you.
Bye.